Now, let's continue with the prospect of hotel quarantine being introduced for travellers arriving into England, especially from countries where the variants of coronavirus are prevalent. Well, for the limited number of travellers who manage to purchase a ticket to Australia, they are greeted with a strict 14-day isolation period on arrival. Passengers are allocated a nearby hotel room, escorted there to begin their quarantine, and will likely pick up a hefty bill on departure. Sarah Nickson is from the Institute for Government. She's currently in Australia and wrote a report on the hotel quarantine setup over there. So really interesting to talk to you today, Sarah. Thank you very much for joining us. I spoke a little earlier, actually, to someone who's currently in a hotel in Sydney, quarantining after arriving there a few days ago. She described a slick process, escorted by the army from plane to hotel, a daily call from a nurse, a payment by instalment scheme once you leave quarantine. What are the challenges in getting to a system like that, in setting it up?
Yes, well, I think you've pointed out quite a relatively smooth and slick operation, but that didn't happen overnight. It took a little while for Australia to get there, and you need to remember we've been working with this system since March last year. So the two key things that stand out to me that the UK need to think about in setting up this quarantine system, if they do go down that path from a logistical side of things, is on the one hand, you need to have enough hotel rooms for all the people that are coming in. Otherwise, you will need to find a way to ration that demand. And, Australia has done that through some quite difficult means at times. And then the other key thing is having appropriately trained staff to look after the people who are in quarantine and to make sure that they don't abscond. That bit in particular was a challenge, particularly in Melbourne, where private security contractors took charge of the security side of things, and they didn't have quite the training and expertise in infection control procedures that were necessary to keep the virus contained to travellers in that hotel quarantine setting who already had the virus.
Were any other flaws in the setup identified in the early days, Sarah?
I think that there were teething problems certainly at the start. Some ranging from the fairly trivial to the quite significant. A lot of complaints about the quality of food and lack of fresh air breaks. A lot of these hotel rooms don't have windows that open, and that can be quite trying. And then, of course, there are people in hotel quarantine who have very complex needs, be it physical or mental health. And it took quite a bit of time for the Australian authorities to set up processes to adequately cater to those needs.
Now, the government here in the UK is reportedly considering using outsourced private security in quarantine hotels, which, as you mentioned, was implicated in some of the early teething problems with Melbourne's facilities. Generally, how well set up, though, do you think that the UK is in terms of number of hotels, available qualified staff to run that sort of system here?
Yeah, I suspect that the UK will find very similar challenges to Melbourne. So there have been figures made public around, there are about 10,000 hotel rooms in the vicinity of Heathrow and a similar number of international arrivals coming into the country each day. So clearly capacity is going to be a big constraint. You point out there about private security guards. Whichever workforce.
The UK is much more interconnected. London, especially as a hub, is much more interconnected in many ways than Australia, say, and New Zealand.
Yes, that's exactly right. So, it's been really difficult for Australia, both in economic terms and in human cost terms. But then when you look at the comparative figures about the number of people arriving in both the UK and in Australia every year, the last normal year, you could say, 145 million people arrived in the UK from abroad. The same year, it was 21 million in Australia. So, the challenges that Australia faced, I think the UK will face those on an even larger scale.
OK, Sarah, really interesting to talk to you and hear about your research. Sarah Nickson, senior researcher at the Institute for Government, who wrote a report on the Australian-style quarantine system.